regularly cursed at, and sometimes physically assaulted by patients. Nurses in the U.S. have had enough. As VOA's Veronica Balderas Iglesias reports, the pandemic is accelerating long-standing problem of violence against frontline healthcare workers.
Clipped to his ID badge, Nurse Benjamin Coe has something extra, a panic button.
I've only been physically assaulted by a patient twice, but every single shift that I've ever worked as a nurse, at least one patient is going to use curse words at me, is going to make violent statements towards me.
Coe says the COVID-19 safety protocols aren't always welcome.
They're taking their frustration out on visitor policies, and the vaccines and the treatments have just been so over-politicized that it's politics at this point that's driving the problems.
A September survey from National Nurses United shows that 31% of hospital nurses experienced workplace violence, up more than a third since March. ICU nurse MAWATA KAMARA says a national nursing shortage is partly to blame.
We have more people getting agitated for things such like waiting too long in the emergency room. Unfortunately, the reality is I have other patients that are also equally sick, and I can only dedicate a certain amount of time to this patient.
After being assaulted, nurses can report what happened to supervisors or the police, but they don't always do so. On social media, however, they are not so shy.
Nurses are afraid to report anything because of retaliation, because of feeling that like they're going to be blacklisted, or they're told by the facility not to make a report because of patient satisfaction scores.
That's where accountability breaks down. No reporting means attackers can get off scot-free, explains Richard MEREU of the Emergency Nurses Association.
We're up to approximately 31 states that have felony laws. So if you violently assault an emergency nurse, if you are convicted and it's a felony, it's generally a year of jail time or even more.
A proposed law in the U.S. Senate would require employers to protect nurses and others from reprisal for reporting abuse. It also mandates tailored prevention plans. The Maryland Hospital Association represents 53 hospitals and 7 health systems. In the last 5 years, its members have taken multiple steps to prevent workplace violence.
More cameras, more actual security guards, sometimes with canine.
But with all the politics in this pandemic, security only goes so far.
The nature of healthcare in a hospital is such that you can't eliminate the opportunity for harm. I mean, you've got to have caregivers and patients face to face.
Nurses like KAMARA want a seat at the table when hospitals plan for safety.
Nurses don't want to quit, but if a nurse had to choose between, keeping a job and coming home, with a broken jaw or coming home traumatized every day, I think a lot of people would choose their peace of mind.
The more than 4 million registered nurses in the United States have shouldered a huge burden in the pandemic. A little help from their patients, they say, shouldn't be too much to ask.